Hello, in this video we're going to talk about breastfeeding in the first moments after birth. The best thing we can do to help our baby to breastfeed soon after birth is to place the baby skin to skin with mummy. Usually what will happen is the nurse will dry the baby off, which is going to help the baby's circulation. And what we want to do is keep the baby's hands nice and moist, because this is going to help the baby to find the breast instinctively. And your job as a new mum is to help the nurse to dry your baby off. I want you to give your baby a kiss and wish your baby happy birthday. What we want to do is we want to keep our baby skin to skin for at least 1 hour after birth. There are many advantages to giving your baby skin to skin contact. It's a good way to keep the baby nice and warm. It gives the baby access to the breast straight away, which helps to prevent hypoglycemia. It also helps to stabilize the baby's breathing and the baby's heart rate. While our baby is skin to skin, they're going to use their innate reflexes that they're born with in order to help them to find the breast. So babies are born with a step reflex, babies are born with a rooting reflex, and babies are born with a sucking reflex. So all of these reflexes will be used for them in order to find the breast themselves. If you have a C-section, your partner can put your baby skin to skin until you arrive in the recovery room, which is when you want to put your baby skin to skin so that your baby will have access to the breast. In many hospitals nowadays, you can actually put your baby skin to skin during the C-section. So don't be shy, ask. Of course, every mum has milk straight away. Milk is started to be produced in the breast from about 14 weeks of pregnancy. So when your baby is born and the placenta comes out, your breast will contain colostrum. And colostrum comes in very small quantities, but it's very, very nutritious and high in antibodies, which is just what your baby needs. There are some factors that might influence when your milk supply will increase. And some of these factors might be problems in pregnancy, such as high blood pressure or diabetes, also having a long labour and complications during labour, such as having a C-section. So we just need to be patient, because your milk supply will get established. So feeding your baby within the first hour of life and keeping your baby skin to skin for much of the time is going to get you and your baby off to a good start. However, in the unlikely event that your baby is not able to take the breast, it's very important that you express your colostrum and you give that to your baby as soon as possible. We have a video on how to express colostrum and how to feed your baby with a cup or a little spoon.